Okay, so if you've ever had a spine MRI for back pain, you know that report can be a lot. It's this amazing tool that can see just about everything. But, sometimes seeing everything just creates more questions than answers. So today, let's try and piece together this puzzle of the spine MRI. And this right here is the big mystery we're diving into. We have this absolutely incredible technology that gives us a picture-perfect view inside our own bodies. And yet, for so many people, that perfect picture just doesn't line up with the pain they're feeling. So how is it possible that a scan can show a problem that isn't really the problem? Let's unpack that. And that question brings us right to the heart of what we're calling the MRI puzzle. It's that classic situation where getting more and more information doesn't actually lead to more clarity. In fact, sometimes it just makes everything a whole lot foggier. This quote from the research we're looking at today just absolutely nails the issue. So what does it mean? Well, an incidental finding is something the scan picks up that, honestly, isn't causing you any trouble at all. But the actionable pain generator, that's the real culprit. And for a radiologist who's just looking at the images, telling those two apart, it's been nearly impossible. Here's a great way to think about it. A lot of the things an MRI flags, like a little disc degeneration or a slight bulge, are really just signs of aging. They're basically like wrinkles, just on the inside. In fact, get this. Studies have shown that a huge number of people with absolutely zero back pain have these exact same abnormalities on their MRIs. So the real trick is figuring out how to separate the signal, the true cause of your pain, from all of this background noise. So, where does all this confusion come from, really? Well, the core of the puzzle is a kind of communication breakdown, a critical information gap between the two main experts who are trying to solve your pain problem. And you can see that gap laid out right here. On one side, you've got the spine specialist. They're the one who actually sees you, talks to you, and really gets your story. But then on the other side, you have the radiologist, who traditionally has been pretty isolated. They're just looking at a set of images completely cold, without any of that crucial context. They have all the visual data, but they're missing a massive piece of the puzzle. So what is that missing piece? Well, it turns out to be something beautifully simple. The key that unlocks this whole puzzle, it comes directly from you, the patient. Your personal story is the treasure map that leads everyone to the right spot. And the tool they use to capture that treasure map, it's surprisingly low tech, just a simple pre-MRI questionnaire. Before you even get into the scanner, you fill this out, describing your symptoms in detail. That information then goes straight to the radiologist. And believe me, it completely changes the game. It changes how they see your scan. And these aren't just any old questions. They're super specific, designed to give the radiologist real diagnostic clues. Are you feeling a sharp electric pain? That points to a nerve. Is it more of a dull, throbbing ache? Well, that suggests it's a joint or a disc. Every single answer helps them build a much more accurate picture of what's really going on. And this is just so smart. The questionnaire uses this clever branching logic to zero in on the precise location of your symptoms without bugging you with dozens of questions that don't apply. So if you say yes to leg pain, it starts drilling down further and further. And this detailed map is absolutely essential because the specific path your pain travels tells the radiologist exactly which nerve root is probably the one causing all the trouble. Okay, so the radiologist has your treasure map. How does the process change now? Well, armed with both the images and your story, the radiologist basically transforms from just an observer into a true medical detective. Now, this is a really big deal. That questionnaire helps the radiologist figure out which of these two main types of pain you have. Radicular pain, that shooting, electric feeling that goes down your leg, that just screams nerve root problem. But axial pain, that dull ache that stays mostly in your back, that points to other things like the discs or joints. Knowing which one you have lets the radiologist focus their search like a laser. This all leads to a powerful new three-step process. So first, the radiologist does a quick skim of the images, just to form an initial idea. Second, they sit down and read through your questionnaire answers. And then, and this is the magic step, they go back to the images and they actively look for a direct, undeniable match between what they see on the scan and what you told them you're feeling. And what's the result of this new approach? It's transformative. The final MRI report goes from being this long, confusing list of possibilities to a single, clear, and confident conclusion. And to make it really clear, radiologists now actually give it a score, a concordance score. Getting a 5 out of 5 means a perfect match. It's the radiologist's way of saying, yep, I am highly certain that this specific thing on the scan is the real source of this patient's specific symptoms. And here's what that actually looks like in a real report. See that? Instead of a laundry list of degenerative changes, the conclusion is direct, it's actionable, it tells the spine specialist exactly where to focus their attention. This isn't just a better report, it's a much, much better roadmap for your treatment. So let's bring this all home. What does this really mean for you, the person who's actually in pain? It means we're finally putting the patient right back in the center of the diagnostic picture, where they belong. So here's the bottom line. Your story, what you're actually feeling, is now treated as crucial medical data. This simple step helps radiologists give a much clearer, more confident diagnosis. That means your doctor gets a report that's way more useful for guiding your treatment. And all of that leads to better, more targeted care for the real problem, not just some random shadow on a scan. And this whole thing leaves us with a much bigger question. This entire process is about using a patient's story to make a super high-tech tool even smarter. It's a powerful reminder that sometimes the simple act of listening is the most advanced medical technology we have. So it makes you wonder, where else in medicine can the patient's story make our care even smarter?